Hi everyone, my name is Meenakshi. I'm a junior doctor working on the Specialised Foundation Programme at Imperial College, and just making these videos to share my experiences in clinical and non-clinical medicine and also just life in general. So do let me know if there's anything in particular that you'd like me to talk about. But a brief background on myself. I was born in India, so shout out to my Mumbaians out there. Moved to the UK, did medical school at St George's, and now currently working with Imperial College in academic anaesthetics, which I am super excited about. And I guess that the heart of this video really is to address a question I get asked quite often, and that's about, how to get into health tech, what was your journey, and I mean, I do not claim to be an expert. I really am still trying to find my own feet in this field, but it has been a very fascinating and interesting experience so far. So I can give a brief background on my journey and a few learnings of, just the takeaway messages that I have so far. So I started out on this journey in third year of medical school. I'm personally the kind of person that likes to have something on the side. It stimulates another part of my brain, and I really enjoy that. So I was part of Medic Bleep for about 2 years. I worked with them as a research and marketing associate, and that was an amazing experience. Wrote original research articles, spoke with different stakeholders, built my network, but more importantly saw how health technology can still have a huge impact in terms of improving patient care. So that was an amazing experience. And then I worked with BMJ Innovations as the editorial fellow, and this again a very educational experience, I would say, not just in terms of learning about new innovations, but also in terms of the academic side. I reviewed articles that came into the journal, gave my opinion in terms of whether they should be published or not and how they could be improved, but also just, again, learning about the different innovations that can impact healthcare. And I suppose a common theme here for me is knowing what my value and my purpose is in health tech, and that is to somehow still have a scalable, direct impact on patient care. So that's a value that I take forward each time whenever I'm trying to whenever I'm considering something, a new opportunity. And then that led me on to working with Rise, which is a digital health asset management firm, and I guess that really made me appreciate the journey health tech founders go through, how investment firms think in terms of who to give investment to, and in terms of where a med student or a clinician can provide value is doing the due diligence, clinically validating the product, looking at the research, seeing if it's a legitimate produce that could help and deliver what they are setting out to do. And now, I guess, yes, I'm working as a junior doctor, so I don't get much time in terms of health tech, but I do work as a digital associate with Quiddity Health. And here again, lots of exciting projects. Currently I'm working with the Royal College of Radiologists, which has been amazing. So to really answer the question of how to get into health tech, I would say there are a few questions that one needs to ask themselves, and that I would say would be, why exactly do you want to get into health tech? What excites you about it? A key learning that I've found is, health tech is just as intellectually stimulating as clinical medicine. First of all, there is no comparison. Clinical medicine is a field of its own, but it's very important not to go into it with the mindset of, oh, it's just very easy and you know, it's fine. You still have to apply your knowledge, and obviously it depends on what your goal is and what your purpose is and where you want to get to and how you want to provide a service and what impact you want to make. But personally, I do believe in whatever you're going to do, you have to do it well, and I think that is probably something that will give you the most satisfaction. So yes, I would say ask yourself why. Ask yourself why, you know, what excites you, and after you've answered those questions, in terms of the practical advice and how I got my opportunities, I'd say make a LinkedIn account. I can't express how important this is, and I'm not trying to advertise LinkedIn here at all. I think the majority of my opportunities, I got them because of LinkedIn and because of networking with different individuals and speaking to like-minded people and sharing my passion for healthcare and how to provide that value. And secondly, this also links in with networking, but attend events where you're visible, you're able to speak to different people. If you just do a quick search on Google about health tech events happening, or look at LinkedIn or look at Eventbrite, lots of opportunities there to get involved. And thirdly, whatever stage you're at, if you're at med school, if you're working, see if there are any opportunities in your organization for you to get involved in innovation and changing processes and kind of quality improvement projects, because although sometimes it might not be directly linked to health tech, a lot of the skills that you might require in health tech are things that you can culture doing these projects. So that would be my advice so far, and yes, I hope that's helpful. Do let me know if there's anything I can you know, talk about further, but my direct messages and my email is always open to people. I know a lot of you, depending on who's seeing this video, might be going through the application process to apply to medicine, slash applying to the academic foundation program. If you'd like me to talk about that in a bit more detail, more than happy to. Just drop me a message. But I hope this was fruitful for you and educational, and I look forward to seeing you and providing my experiences more. Bye!